studio now with Casey Hall, and she is a physical therapist. She has some very interesting ideas about what to do when you really feel some pain and how she can help. So Casey, welcome.
Hello, thank you very much. Actually, I'm a physical therapist assistant, but very proud to represent the Physical Therapy and Rehab Department of Green Spring. I'm very happy to say that this month is National Physical Therapy Month. Okay. So a wonderful month for all of us, and I would like to send my best wishes to all the physical therapists and physical therapist assistants that work at Green Spring and most of the area. It is a wonderful occupation, very rewarding.
Yes.
So met a lot of interesting people.
I can imagine.
Yes. So the campaign for the American Physical Therapy Association this year is that pain is personal and treating it takes teamwork. So choose PT. And one of the reasons that they did this is because of the growing epidemic of opioids.
Oh.
Okay. So like you say, it's kind of a interesting thing that's going on in the medical profession to try and manage people's pain.
Without the opioids.
Without opioids. However, obviously sometimes some pain medicines are needed, but one of the things that they have found, the Health Services Research did a study, and they found that patients who are treated with physical therapy are 89% less likely to need opioids.
Good.
Which is wonderful.
Yes.
Now, everybody wants to know, and no one wants to have pain, but one of the things that we do in physical therapy is we examine the mechanics of where you might be having the pain. We address through motion and strengthening and education how we can help to minimize the stress on a joint where you might be having pain. We can do manual therapy, and we have a vast variety of modalities that can be done to help address the pain, to resume a more obviously enjoyable existence than having pain.
Right.
Most people have pain. It varies between, unfortunately, something that might have happened, the infamous fall, or I suddenly went down to take the trash out and I twisted and then I have back pain, or I fell on my knee, or I was carrying a suitcase because it's almost time for the holidays and everybody's going to be visiting people, and so maybe I had to get the suitcase out for my visit over Thanksgiving. So shoulder pain might be occurring, but basically we have the modalities that we have are obviously the traditional heat and ice. That's the easiest, right? That's the one that most people go to immediately.
Right.
The other things that we have, depending upon your other medical issues, we do have to examine those to make sure that we're not going to do anything that might be harmful to you, obviously. But we have ultrasound and electrical stimulation and shortwave diathermy, and obviously I said manual therapy. Manual therapy encompasses a lot of things. So sometimes it's just moving the joint around, and sometimes it's moving the tissue around, or obviously, who doesn't like a massage? However, sometimes it's appropriate, sometimes it's not. As a rule of thumb, we usually try to address the stresses that have brought you to that, to have to come see us. With that said, in order to come and have physical therapy, what you're going to need is a prescription from your physician for what might be ailing you. And we can take a prescription from your primary care physician or your specialist. So a lot of people are like, oh, well, I hurt my knee, I need to go see my orthopedist, but I can't see my orthopedist for another several weeks or so sometimes. Or if you're one of the things that you can do is you can go and see your primary care physician, or if you have an internist, you can just go and have them look at it. They can do the preliminary ruling out of the normal things of fractures or anything like that, and then they can give you a referral to physical therapy.
I know some people feel, they twisted their back and they think, well, it'll get better, and I hate to bother the doctor with this kind of thing. And
Yes, I totally understand that. We hear it all the time. What I usually tell people is that you have to be concerned with consistent and persistent. So yes, you have the incident and you might be a little uncomfortable, but with each passing day, it should be getting better. If by the second or third day you're like, it's not any better, obviously if you do something immediate and you're unable to get up and down from a chair or in and out of bed, I would say that that's not something that you can necessarily correct.
Right.
But as the days pass from the initial incident, your symptoms or the discomfort should improve, okay? I don't believe that anything at this stage in the game is something that we should necessarily be like, oh, well, I don't really want to bother people. Because one of the things that you can do is, obviously, I'm in a profession where I feel like I can do something good for everybody.
Sure.
Even if we can't necessarily reduce the pain as much as people want, but if you walk in and you're having 8 out of 10 pain, that's pretty significant and pretty life impacting. But if we can get it down to a 4, I think that that's relatively...
Give me the description of the levels of pain.
Yeah, so 0 is that you don't have any pain at all.
Okay.
And we usually tell people that 10 is the worst pain. We have to go to the emergency room that you've ever felt in your life.
You just can't stand it.
Right. Now, obviously, we would ask you this question, and everybody's individual. So what my pain isn't pertinent. It's your perception of what you're feeling and our assessment of how you're doing. It's a joint effort. So even if you say that you're having, because people go, oh, well, I have pain all the time, so this is barely nothing. And some people will say, oh, well, it's only like a 3. And you're looking at them and you're like, oh, that looks like it would be really uncomfortable to me, but you're saying it's a 3. So you have to kind of take it into consideration what people are telling you. Some people will walk in without any, and they'll tell you that it's a 9 out of 10. So you take that in conjunction.
On how people
right. But
tolerate pain.
Right. But any level of pain, how small or how large, I believe will always be benefited from having education on strengthening and techniques on how to do things, getting in and out of bed, up and down out of chairs, because these are all things that we help people, not only to help them through a difficult time right now, but kind of as a precursor to prevent things that might happen in the future.
Okay.
Because something that might have happened several months ago in regards to a shoulder or a knee injury, your body takes that information internally and then it begins to compensate and do things. And unfortunately, we've kind of found that the human body, though it doesn't like pain, it doesn't necessarily always choose the most appropriate or efficient way long term. So having an evaluation to assess what might, even if you then come in and you're like, well, I had the pain, and unfortunately when I went to see the doctor it was more, and now it's better, that might not take as long as someone else, but the benefits of learning things to prevent it from happening in the future, to help make you the healthiest person that you could be, the strongest person, recommendations of things that you might be able to then do with the fitness center or on your own to help make sure that you can continue to be the functional, enjoyed person that you can in the community, because there's so much here to offer.
Well, and there's so much, for instance, in just rearranging things sometimes on a shelf.
Correct.
That, things you get to all the time, don't put on a top shelf.
Correct. Yeah, and like you say, a lot of times the outpatient rehab center offers occupational therapy, speech therapy, and physical therapy. You can talk to your doctor and they can help differentiate between occupational therapy. Correct. Activities of daily living, bathing and dressing usually are more occupational therapy, hands more occupational therapy. But like you say, unfortunately, I'm only 5'2.5" on a good day. So me trying to reach the third shelf in a cabinet or the shelving units in the closets is going to be much different than somebody who's 5'10".
Right.
However, managing this, I too have to make sure that when I'm at home that I'm moving as efficiently as possible and not just trying to get it done because I'm only got this little bit more to do.
Right.
But these are the things that we can help, so that it might help you so that the next time this situation rolls around, you can make a little better decision, or that the awareness that you feel that you might go kind of use what you're feeling to manage what needs to be done. So if you're going to do something, instead of going, oh, well, there it is, I just can't do it that way, are there ways structurally, posturally, that I can do to make these things better for me? So that
And
I would
also
be able to.
knowing that point beyond which you should not push.
Correct. Yes, climbing on things and trying to overdo it, and like you say, if anything's on an upper shelf, not only even if you can reach it, how many times has the sweater fallen on the top of my head because I didn't, even though I can get up to get that one platter that I wanted for the people coming over that afternoon, reaching it, but then being able to get it down in a safe manner that we don't break it, ruin it, or hurt yourself.
Right.
A lot of times too, like you say, reaching up structurally puts you at a disposition to fall backwards or sideways. So these are things, it's kind of multifold.
Right.
So being able to address what's currently going on from a pain standpoint, minimizing the pain, if there is any when the time is that you do happen to come, but then being able to address motion, strength deficits, so that you will be able to manage these things, large or small.
Right.
Yeah.
Okay, we're down to the last minute. You have any really words to the
wise?
well, or to those who are not quite so wise?
For the Well, I just like to say that again, if you have discussed these with the doctor, if you have any concerns or questions about things that might be going on, ask them for a referral to the outpatient clinic in Hunters Crossing. They can fax it over directly, even if it's an outside doctor, and then we would get the referral and contact you as to when we would be able to get you in.
Okay.
So nothing is insignificant to be looked at.
Okay. Sounds satisfying, let me say that.
Well, yes, and
That there is
meet.
something that can be done.
There is something that can be done, and may we never meet except socially.
Right. Exactly. Thank you so
You're
much,
welcome.
Casey.